Again, once again in Texas, where coronavirus infections are surging. Prior to June 1st, hospitals in the 25 counties that make up the southeast region of the state were averaging roughly 700 emergency room patients Thursday. And on Thursday, that number hit a new high, 1,320 patients. Dr. Bela Patel is the director of critical care at Houston's Memorial Hermann Hospital. She's with us live tonight. Dr. Patel, thank you for taking the time. Describe what the last few days have been like for you.
You know, I think that before June 1st, as you mentioned, we actually were seeing a steady state of COVID patients, and we were able to manage them. Right now, since June 1st, we've seen a steady incline in the number of cases week by week. And we are noticing a 40 to 60% increase in admissions in the hospitals. And we're noticing about a 6% positivity rate on testing when it was previously 3%. So as we're starting to see this incline, we're preparing and really re-engaging the city into making sure that we are actually doing all the things that we know we should be doing to decrease these rates of infections.
Dr. Fauci was just speaking on CNN. He said that places like Texas should be thinking about slowing down. Obviously, the decision is up to the governor. But what would you suggest from your perspective to keep your hospitals like yours from getting overwhelmed?
Well, I think that we know that what lockdown feels like. We know what to do. So really, if we all practice the same way, we are wearing our masks, we're doing hygiene, we're only going to stores and places where that absolutely need to. And we do go to those places of business, we really then need to make sure that we are actually all wearing masks and all protecting ourselves. So I think that just by doing the things we already know, that we could actually carry on a normal life or near normal life without actually continuing to increase the spread. So it's really getting back to the basics.
What is the severity level of the patients that you're seeing? What have you noticed?
You know, we have noticed that now that we've gotten used to dealing with this virus in the critical care setting and in the inpatient settings, that we actually have some tools in our toolbox, so to speak. We have remdesivir. We may have other therapies that we can actually provide patients. So we are seeing decreased rates of patients needing critical care beds, and we are seeing decreased lengths of stay in our hospital. So we are managing patients better. Patients are having better outcomes. But despite that, if we're not really monitoring these rates and really putting in interventions to continue to stop the increase, we will then overwhelm our system, and that's really what we don't want.
What about the ages of patients and underlying conditions? Obviously, that was a huge part of the hospitalizations that we saw in the New York area a few months ago.
Yeah, we're seeing a broad spectrum of ages. We're seeing some pediatric patients, but the ones that tend to get hospitalized still tend to be the patients that are a little bit older, have some comorbid conditions, and the ones who end up in the critical care units are generally those patients. So, but it doesn't mean that, 20 and 30-year-olds can't end up in the hospital. We're just wanting to make sure that everyone protects themselves. And if you're really healthy and you feel like getting the virus isn't going to put you at significant risk for being seriously ill, just remember the people around us. We can start infecting our parents, our neighbors who may have those underlying conditions and put them at risk.
And how much capacity do you have left in the ICU at this point to handle this outbreak?
So right now we have adequate capacity. We've been preparing. We still have across the city of Houston, it looks like we have at least 10% more capacity. But we know how to manage this. We know how we need to compensate for increased demand across all of our hospitals. So we can manage it currently, but we just want to make sure that 4 or 5 weeks from now that we're not in a place where we're going to have to make tough decisions.
Dr. Patel, did Texas open too aggressively, in your view, that led to this?
I think it's hard to tell. I mean, I think our rates started going up after Memorial Day weekend, and clearly that may have contributed to the rise. But I think even though Texas has opened up, it really depends on how we practice day to day. So, and that question, I think, will as we're continuing on, we'll be able to get more details and try to figure out if that was the reason. Certainly it contributed, but again, it's in really all of our responsibilities, the businesses that are opening, making sure that they're actually providing the right types of environments for the customers and the customers to make sure that they're actually putting their health first.